of New Mexicans by implementing and evaluating effective strategies for cardiovascular disease prevention and management. This is, of course, with a focus on health equity. And we work to implement activities that improve quality of care as it relates to blood pressure and cholesterol control. So, very briefly, we are working on 3 strategies with the CDC to really work over the next 5 years. We're in our first year of our 5-year grant cycle. So our first one is to track and monitor clinical and social services and support needs and measures shown to improve health and wellness, healthcare quality, and then really identify those patients at highest risk for CVD with a focus on hypertension and high cholesterol. We're using that or doing that by working with our partners to increase the use of electronic health records and health information technology to report, monitor, and track clinical and social services and support needs data, really by focusing on demographic data. So we're not just wanting to see the overall picture, we're wanting to see that by those patients of higher need, those patients at greater risk. And in addition to that, we're working with our partners to implement the Prepare screening tool, which you will learn lots about here very shortly. But we're hoping to do that. And of course, just identifying those needs is not enough. So our next steps then are around referring those patients into those social and support needs with strategy 2. So we're implementing team-based care to prevent and reduce cardiovascular risk with a focus on hypertension and, of course, high cholesterol prevention. We're doing this through the detection, control, and management and mitigation of social support barriers. So we're doing this by really working to build a foundation. We know in our state, team-based care is difficult. We only have a few large healthcare systems, and it's difficult in the more rural parts for our patients to get to multiple appointments and to really have that care team because they are spread out all over the state. So we're working to connect them through CHWs as well as the use of electronic health records and health information technology to really allow for those care teams to connect. We're also increasing the use of these multidisciplinary care teams by creating the services and the connections. We're developing a database and a directory of social and support services throughout the state, and then, of course, through our learning collaborative. And so our third is, of course, linking the community resources and the clinical services that support these referrals, self-management, excuse me, and lifestyle change to address these social determinants. So we're doing that, of course, through increasing access to referrals, connecting our partners in healthcare settings with community-based organizations that are not only offering social and support services, but lifestyle change programs. We're also working to increase the engagement of community health workers in these clinical settings. We're doing that through education, as well as connecting them to be really that bridge of a care team. And lastly, we're doing this by increasing the use of self-measured blood pressure with clinical support. All right, so last slide. I'm trying to get through this kind of quick for y'all. But of course, these are the members of our team. So you have myself, the program manager. We have Sarah Tolbert, our health educator. She's also our community outreach coordinator. So she oversees a lot of the work with this population health collaborative. She's an excellent resource and person to reach out to if you have any questions about the collaborative or have any desires to be perhaps on an agenda for a future meeting. We have Blanca Crystal Ramirez. She's also a health educator, and she's our QI specialist. So a lot of our health system work, she really heads up and coordinates. So she's also a wonderful resource. And newest to our team is Elizabeth Bicio. She's our epidemiologist and all-around data expert. So she is one to reach out to if you really need any assistance with data around heart disease in the state. So thank you so much. I just wanted to keep this brief and give you a little bit of an introduction into this work that we'll be doing together over these next 5 years.
Thank you, Lindsay. Much appreciated. So without further ado, I am going to introduce our guest speaker today. We have been lucky enough to have her. I believe she was traveling for a conference, and she's also going to be joining us for our Health Equity Symposium in person. So I just kind of wanted to plug that again. But this is help me welcome Neilani Tarrant. She is the Deputy Director in Social Drivers of Health for NAC. She is where she works to help health centers build community-based and patient-centered research and data capacity. Currently, she focuses on helping health centers collect use of social determinants of health data to improve care delivery, inform policy, and accelerate community change by developing, testing, and implementing the standardized social determinants of health protocol known as PREPARE, which some of you may or may not be familiar with. Previously, Nalani was a director of Quality Collaboratives Data and Quality Measures at the American College of Emergency Physicians, where she worked with physician leads on transforming clinical practice initiatives supported by CMS. Her interests heavily lie in identifying solutions to lessen our nation's health burden by identifying solution that aims to effectively promote better health outcomes. Ms. Turrent earned her bachelor's in behavioral science from Drew University and an MPH in epidemiology from George Washington University, and completed her project management professional accreditation. So please help me welcome Nalani, and I will pass it on to you.
Great, thanks so much. Hi, everyone. I'm very glad to be here. It's been quite a whirlwind of a week for me, but I'm glad I can speak with you folks about social drivers of health and Prepare. So I just want to do a quick acknowledgement that Prepare, which is an SUH screening tool that we'll be discussing this afternoon, has been a long-standing collaboration between NAC, APSHO, and OPCA. And today I will be the presenter. So I'm from the National Association of Community Health Centers. So to set the stage, I want to start off by talking about social drivers of health. As you are probably aware, these are the conditions in which people are born, grow, live, play, work, and age. And these conditions are shaped by the distribution of money, power, and resources. And as a driver of health inequity, social drivers of health have shown a greater impact on population health and individual well-being when compared to medical care. So although medical care is essential, it only accounts for about 10 to 20% of the modifiable contributors to healthy outcomes for a population. The other 80 to 90% have been attributed to the social, economic, and environmental factors that we refer to as social drivers of health. You probably have also heard this term, social determinants of health, which is the same as social drivers of health. So at NAC, we have decided to lead with the term social drivers of health in lieu of social determinants of health, as this more accurately describes the ability for policymakers, communities, and individuals to affect change on the factors that are negatively impacting health and well-being. Because we realize that when using the term determinants, it can have a sense of finality, removing individuals of their agency to manage their own health and well-being, and also minimizing the accountability amongst policymakers and those in power for the social and political decisions that have created these inequities. So we know that the struggles such as access to nutritious food or affordable housing, they're not predetermined and can actually be changed depending on how those money and resources are distributed. So as we understand that social needs drive health inequities, this often stems from structural racism and discriminatory policies. And as we are on this journey to achieve health equity within our country, it's clear that our current care delivery system is fragmented and it falls short in addressing social needs, really leading to the disparities that we see in various health indicators such as life expectancy, quality of life, disease rates, and even access to treatment and care. So achieving health equity requires leveraging the data we collect in order to understand the needs of patients and communities. This data enables effective communication across care teams, community partners, with policymakers and payers. It can help facilitate the development of new or enhanced interventions, forge community connections, and establish efficient care decision-making processes. And additionally, what I think is critical in this care transformation process is really moving the needle in achieving health equity with the data and actively engaging your patients in addressing their social needs. And so when we start pulling back the layers, we can see the impact of SUH data across these different levels. At the individual level, breaking that out into two tiers, starting with patients and families, we see that individuals start to feel empowered about their health and well-being as they are now being included and engaged in conversations to address their care needs. And then the second tier in this level is care team members. They can now better manage their patient and population needs by having a better understanding of what those needs are. Okay, so trying to going back from the community local health system, really having this data, you can focus on making changes at your community level, whether that is creating cross-sector partners, looking at strategies to focus on prevention, and also, once again, advocating change to local policies. As we move up into in this graphic with the payers, this data can help execute payment models that sustain value-based care. And then when we're thinking about policy level, specifically state and national policies, The data you collect and share can work to ensure that policies are created or changed to better serve your community. But how do we collect SDOH data, right? There are many SDOH tools out there, and one of them is PREPARE, and that stands for the Protocol for Responding to and Assessing Patients' Assets, Risks, and Experiences. It's a national standardized patient risk assessment tool that has been designed to engage patients with their providers in assessing and addressing social drivers of health. So just a little background on PREPARE. So this tool was started the development in 2013. It went through several review periods with community health centers and other healthcare organizations and stakeholders. As part of the review process, each question was reviewed by a health literacy expert to ensure the comprehension was at a 4th to 5th grade reading level. When the tool was finalized, it resulted in these 20 domains, with 16 of them considered core and 4 optional. And approximately today, about 70% of community health centers utilize this tool as their tool of choice in assessing for social drivers of health needs. So when we break it down, there are 5 main reasons why folks choose to use PREPARE as their tool of choice. It's actionable. Through the use of PREPARE, the care team can effectively take meaningful action to address patients' social needs. It's standardized and widely used, so we have aligned PREPARE and cross-mapped it with codes such as ICD-10, LOINC, and SNOMED. And as I mentioned, it is the most dominant SDOH screening tool amongst community health centers. And we're also starting to see an uptake in the use of PREPARE with other healthcare sectors. It's evidence-based and stakeholder-driven. So the PREPARE development really focused on drawing from existing evidence on social risk while also integrating insights from national efforts. And it has also undergone rigorous validation and testing with health centers and several other healthcare organizations. And the last 2 points I feel are very unique with PREPARE is that it's designed to accelerate systemic change because this data can serve as a catalyst, enabling things such as risk stratification to pinpoint complex patients in the need of social interventions. You can use this data to foster relationships with community partners, payers, and policymakers as well. And lastly but not least, it's patient-centered. PREPARE has been designed to facilitate meaningful conversations to help build stronger patient-provider relationships. So it's really not meant to be a checklist of questions, but rather an avenue to build that relationship. I'll also note that PREPARE has been translated into over 20 different languages. And in order to respect autonomy and an individual's autonomy, we do have a decline to answer option for all the PREPARE questions. So discussing social needs can be distressing, causing discomfort, and that can lead to what is known as social desirability bias, whereas individuals alter their responses to appear more favorable, or they may even avoid certain topics. So as part of being patient-centered, a best practice we emphasize with PREPARE is to consider screening for SDOH needs as a conversation starter, not a checklist of questions. And by engaging a bidirectional conversation, employing techniques such as empathic inquiry approaches, we can mitigate this bias and foster that supportive environment that is conducive for open and honest communication. So to illustrate the importance of inclusion of SDOH screening, I'm going to just quickly describe 2 case scenarios, one that excludes SDOH screening and one that includes SDOH screening. So here we have Maria, who has a medical history of uncontrolled diabetes, missed appointments, and poor medication adherence. She's fallen asleep at the stove that almost caused a fire. She's taken to the hospital where she is diagnosed with sleep apnea, hypertension, and dangerously high blood sugar. For this diagnosis, she receives a prescription for hypertension and is encouraged to purchase a CPAP machine, and she is sent on her way. 2 weeks later, Maria is back in the hospital. She has the same clinical symptoms. From there, the care team has a more in-depth conversation with her, realizing that she was just here 2 weeks ago with the same symptoms, to only discover that she has not taken any medication and is not able to use a CPAP machine because she cannot afford them. So now if we take the same case with Maria and include SDOH screening as part of the initial clinical visit, the care team is able to gain early insights into Maria's social and economic factors that are influencing her health. And they're also able to provide resources. Because Maria has a high risk profile, which is acknowledged during the clinical visit, the care team here now has an opportunity to actively work with Maria to enhance our treatment plan adherence, such as scheduling a follow-up by the 2-week mark that fits with Maria's schedule. This proactive approach is vital in preventing hospital readmissions or additional ER visits, and also in addressing potential health complications earlier on. Thus, in the long run, eliminating, like I mentioned, hospital readmissions and potentially saving costs. So I'm going to pivot just a little to now really talk about how do we get buy-in and engage stakeholders on using Prepare. So of course, we know that with any new initiative, it's important to engage stakeholders who have an interest in the success of the initiative. Involving people who will be impacted by the initiative can lead to strong support and can strengthen the process and outcomes. So we have identified 6 steps to engage stakeholders in actionable order to implement Prepare that I'm going to review. Okay, so as part of the first step, which looks at providing education and gathering feedback, we have a tool that can help initiate conversations within your organization. That is our Prepare Readiness Assessment. And I'll make sure that we provide the link to this assessment. So this can really serve as a compass, helping you navigate through various categories that are going to be critical to the successful implementation of Prepare, such as the culture of the organization, leadership and management, technology, workflow, and process improvement. And so with the first step, once again, you want to spend time educating your stakeholders, but also gathering feedback from them. And this includes organizational members, staff members, but also patients. And this is really going to help with the collaboration and the relationship building. You also want to take time to find out how the stakeholders want to be involved with the implementation of Prepare. Some stakeholders may desire and have the capacity to engage in a more active, direct ways, such as helping to define priorities, collecting data, while other stakeholders may desire or only have the capacity to engage in a more passive way, maybe advising at meetings or providing feedback. What's important is really spending the time engaging and educating stakeholders so that they can make an informed decision as to how they want to be engaged in this process. So as you're educating stakeholders about Prepare, a best practice that we also like to share is to not reference Prepare as a project, but to frame it as a way to achieve your mission, your organization's mission or vision of improving health and healthy outcomes. It's also important to not assume, once again, that stakeholders have any familiarity or understanding of Prepare at the onset. So once again, really taking that time to educate and share information about what Prepare is and the value Prepare will bring to the organization. So once support has been secured from stakeholders, you'll want to set dedicated time to launch Prepare and recruit volunteers. Consider hosting an all-staff meeting, highlighting the importance of Prepare, how it aligns with the organization's larger goals. Ask for volunteers at this meeting, advocating for a no wrong door approach in which each and every staff member can play a part in really helping to paint that fuller picture of the patient and accept all volunteers. Some of these volunteers may end up being your champions of Prepare. So now that you have volunteers and you're ready to start implementing Prepare, here's where, once again, you want to spend time training to ensure everyone who is piloting Prepare is well equipped and that they understand the importance of how Prepare can positively impact patient care and health outcomes and how it aligns with the organization's larger goals. So that way it doesn't come across as, oh, this is just another task that's added to my workload. You want to also take time to make sure you're identifying those champions as well. These are most likely going to be the individuals who have an interest in social drivers of health and have good relationships with patients and other staff members. And these are going to be the individuals that you can lean on to help keep up the motivation and also obtain additional buy-in from other staff members as well. So with implementing any initiative, there's going to be some challenges. And so on this slide, we do have some of the common challenges that folks have experienced and some of the solutions. You might be part of an organization that's already committed to other SOH screening tools. What you can do is a crosswalk that maps those tools with Prepare to show the similarities and differences. You may feel that you have the inability to address social drivers of health at this particular time, but what we like to message here is that you have to start somewhere and do the best with what you have. And also that by collecting this information is going to help you figure out what services to provide. Because unless you are out there collecting that information, you don't know what you don't know. You might have competing priorities within your organization. Here you want to emphasize that to folks that Prepare is going to add value to those other initiatives. Staff turnover is always a challenge. Make sure you're involving multiple staff in Prepare training so that the work can continue. And the last two on the slide, they kind of correlate with each other. How do we implement this tool without increasing visit time and fitting Prepare into a workflow? So you want to make sure that you're spending time to find the right workflow for your organization. There's no necessarily right door to implement Prepare, but really making sure that the staff members who are involved in implementing Prepare have a say in the workflow itself. And also consider looking for that value added time. Maybe it's in the waiting room or during the rooming process or even after the clinic visit, or maybe a little bit of both of all of them. Okay, so in our next step here, it's also important not to forget about the patients. Is that? Yes, sorry, my slides are a little bit off. Patients in this process. So, and there's several ways to engage your patients. You can gather feedback on how you introduce and administer Prepare. This could be through a survey or a conversation as you're administering the Prepare after. You can engage patients in enhancing the community resource guide. A lot of times patients may know about a trusted resource that can be included in the guide. And also make sure that you're engaging patients in any community advocacy for change that you're leading. And by engaging with patients during this process, you'll be able to address social needs that are necessary to improve health and reduce health disparities. And also you'll be able to explain to them why and how these social drivers of health and this information is going to inform and also improve their care as well. You also want to make sure that you have planned opportunities for shared learning, such as by having weekly Prepare huddle meetings. This will allow the staff to regularly share their progress, celebrate success, and troubleshoot challenges in collecting data. These meetings also provide an opportunity to discuss the social economic needs that have been identified and whether the organization has the resources to address those needs in-house, or whether you should examine partnerships with other community organizations. Also, these huddles can create a unique opportunity to invite patients. Here, they can describe their experiences with Prepare and discuss ways to improve data collection and response processes as well from their perspective. And lastly, work to develop a resource list with staff and patient input. And so this list can include internal or external resources, but these are the resources that you're going to refer patients to when addressing social needs. So it can be in a form of a guide, or maybe it's an educational flyer, or even somewhere on the website as well. So the next few slides, I'm just going to review some tips for getting started with Prepare. First, it's okay to start small. Starting small allows you to address any workflow issues or concerns. And it also allows you to apply lessons learned before rolling it out on a larger scale. So for example, the Oregon Primary Care Association piloted an approach known as the 3x10. Where they asked their member health centers to choose just 3 questions of Prepare and ask those 3 questions to 10 patients and report back on the experience. Also, in addition to starting small, you can consider selecting a population of focus. This could be patients with a specific demographic, or consider starting with all new patients. It's also beneficial to create a work plan to formally outline roles and responsibilities for team members participating in the Prepare implementation process. This work plan can serve as a tool to keep your organization's goals at the forefront, and also providing a reminder to your team of the objectives, the roles, and responsibilities as well. And with sustaining engagement and motivation, this does take effort because you are now asking staff members to add another layer to their workload. So make sure you're celebrating success, no matter how small. Encourage friendly competition. Maybe individuals who reach certain milestones could be placed into a raffle for a gift. Also apply lessons learned. If you are rolling out Prepare and you're meeting weekly and you're getting those lessons learned, try applying them in the future weeks and see how those changes go. And also visualize the data. I know for myself, I'm a visual learner, so using dashboards and graphs, that's going to allow folks to better understand how the data can be used to inform care and population health efforts. And when it comes to staff, you also want to make sure that your work environment is supportive. You want to make sure that the workload is manageable and has realistic expectations. Also, encourage a work-life balance. Promote flexible scheduling or time off policies. Make sure that your staff members are aware of those. policies and encourage them to take time off. Supportive leadership. If you are in a leadership role, encourage open communication, feedback, and give recognition to those folks who are implementing Prepare or other aspects in your organization. Professional development, provide opportunities for learning, growth, and advancement. With Prepare, it is on discussing on social drivers of health, which can be a sensitive topic. So you might want to consider some trainings in trauma-informed care or empathic inquiry approaches, which we'll touch upon later on today. Employee assistance programs offer resources for mental health support and counseling, but also make sure that they're normalized being used among staff members. There's no stigma associated with a staff member who may want to tap into one of these assistance programs. Team collaboration and cohesion. This is once again going to really foster that positive team culture and promote that mutual support. And lastly, community partnerships. Look to formalize and cultivate key partnerships with community organizations. It's great if you can do some of the services in-house, but don't feel like you need to do all the services. You can definitely take that data that you're collecting and see what other organizations are out in your community that can help you with maybe some additional resources. And what we've seen is by having a supportive working environment, there is reduced burnout, enhanced team collaboration, improved patient-provider relationships, increased focus on quality and patient-centered care, and leads to enhanced continued care. So for me, it's like a snowball effect. And the sixth point that I found very interesting is the positive organizational, cultural, and reputation. So a workplace that is really prioritizing staff well-being and addresses stress factors is going to create this positive organizational culture that's going to attract and also retain talented professionals, creating that highly skilled workforce in your organization. So from the staff perspective, when we are rolling out Prepare, we want to make sure that we're considering these three factors: fitting Prepare into a workflow, considering what works best for the staff members who are going to be implementing the tool, being aware of the emotional toll on staff. S2H can be triggering for and sensitive for not only the person being screened, but also for the screener. So you're going to want to make sure that, once again, you have those programs and support systems in place that can talk to that emotional and wellness toll for staff. And also lastly, but making sure that staff at all levels are trained. Staff may not understand why the organization is collecting this patient level data, or they may also believe that maybe this is going on somewhere else in the organization. So make sure that you have those 101 trainings, but also maybe some advanced training options as well, such as how do we collect this sensitive data and build relationships with patients at the same time, which one of those approaches is empathic inquiry, which is the next slide. So as I've been mentioning throughout today's presentation, asking about social drivers of health can be a sensitive topic, and we encourage staff members to be trained in using empathic inquiry approaches. Through this technique, you can create an environment that has an added layer of sensitivity, compassion, and empowerment for patients. Because we want to remember that while this data we are collecting is data, it's also on a person's lived experience, and we want to make sure that we're honoring those experiences. And when we use empathic inquiry approaches, we can engage patients with compassionate and reflective communication, really bridging that gap with data and experiences that fosters an understanding that the data collected really represents real challenges and experiences in an individual's life. We build trust and rapport. As we all know, probably from personal experiences, when you feel heard and respected, you're more likely to open up and share more about your experiences. And lastly, these approaches create a supportive patient-provider relationship, which is going to ensure that patients are more likely to be engaged and active in their healthcare journey. Oh, and on the previous slide, we do have a video that it's linked in the slide deck. If you guys have a copy of the slides, that kind of goes over a demonstration of empathic inquiry methods. But when we're
I'll make sure the group gets the video as well.
Oh, perfect. And so when we're talking to someone about social drivers of health needs, you want to start with building with the relationship. First and foremost, consider the setting. Create an environment that is warm, feels safe, inclusive. And as you kick off the screening, start by introducing yourself and your role. You're going to want to be transparent about the screening process, what it entails, why it's important, how long it might take. Make it clear that this is not a checklist, but it's an avenue for understanding what might be impacting the individual's health and well-being. We as healthcare providers, we know that 80% of health outcomes is impacted by social drivers of health, but a person who is not in this field may not be aware of that. And remember to seek permission to have this conversation while also acknowledging that some of these questions could be sensitive. You can make it clear that the individual can decline to answer any question at any point, and there's no penalty and no judgment if they do decide they don't want to talk about that particular SDOH question. Because at the end of the day, it's not just about information gathering, but we really want to spend time building trust and understanding and letting that conversation flow naturally. You also want to ensure the authenticity of the conversation by keeping the focus on the individual. By centering the conversation around the individual, you can create an environment where they're going to feel heard and valued. Utilizing open-ended questions can encourage the individual to share more about their experiences and concerns. You could use statements such as, tell me about your typical experience. What concerns do you have about getting the resources you need? This is going to provide that valuable insight that may not be apparent with closed-ended questions. You also want to focus on strengths. Once again, SDOH needs can be a sensitive discussion, can be sometimes maybe a very, Debbie Downer discussion. So affirmations can be a powerful tool in fostering that positive, supportive environment, really acknowledging the individual's resilience and unique characteristics. You could, we've talked about some of these things that might be challenging to your health. I love to hear more about what do you enjoy? What are your hobbies? What do you find most meaningful in life? This approach not only reframes the conversation in a more positive light, but also is going to empower the individual to recognize and build upon their strength within these discussions. In the last two squares here, you want to pay close attention to nonverbal cues, such as body language, and also employ reflective listening skills to convey understanding. This is just going to add additional layer of empathy and understanding to the conversation. Okay. So on here, you want to take time to summarize key points from the conversation with the individual. This provides an opportunity to address any potential oversights. And you also want to make sure that there's space for the individual to identify what their priorities are and if they're interested in referrals to maybe other team members or community resources. We don't want to make assumptions based on any of those SDOH needs that were identified. We want the individual, the patient, to let us know what their priority is. And as part, can you go back to the other slide? Perfect, thank you. And as part of the conversation, also make sure that you're taking time to acknowledge resource availability and to note that even if a resource is not available at that particular moment, the care team is going to use this information to support care planning and health promotion in partnership with the individual. And lastly, collaboration with the full care team. Keep everyone in the loop because this is going to help improve care coordination and ensure that seamless and integrated approach to the individual's care. So for this slide, kind of should have been, I guess I moved my slides around. So this was supposed to be part of the designing a workflow for SDOH screening, but kind of rewinding a little bit backwards. So when we're considering a workflow for SDOH screening, once again, I mentioned you really want to take time to find a workflow that works best for you. But here we have a framework called the 5 Rights Framework that can be used as a guide to helping you find that workflow. So you want to consider the right information. What information are you collecting on a routine basis? You want to make sure you're not duplicating efforts and ensure that Prepare complements any existing data collection. Then you want to look at how to collect the data by reviewing your current data collection methods. With this understanding, you can devise a clear plan for administering Prepare and ensure that it's accurately and respectfully capturing SDOH needs. In the middle, that states with the right people, this is looking at who's going to collect the data. You want to identify individuals or roles that are responsible for collecting the prepared data, in addition to who's going to address these identified SDOH needs. It's important to clearly outline responsibilities and to also ensure that the assigned individuals have that training to collect this sensitive information. And from there, we can also then fold in the consideration of where and when do we collect this data. You want to find the most appropriate moments during the healthcare encounter to gather S2H information that's in a respectful manner. So there is no right way to implement Prepare. What is important, once again, is finding that right workflow that works best for your team and your organization. So here we have just 8 sample workflow models that health centers in particular have implemented into their center. So I'm not going to go through these today. We do have more information on them in our toolkit, which I'll also make sure that you have a link to that as well. Okay, so with Prepare data in this diagram, you can really see that it can be used in a variety of ways on a variety of levels, from addressing and tracking needs to improving social care and well-being to improving capacity and sustainability for addressing complex patient care and payment reform. And I think I'm getting towards the end of my presentation, but to wrap things up, here's a quick look at the patient responses to data collection. I'm not going to read all the statistics here, but as you can see, data collection was received positively by patients. Patients reported that having conversations about their S2H needs built a stronger relationship with their care team. And they also said that they agreed it was appropriate to ask about these needs. So while this work will add additional tasks and layers to current workloads, it is worth the investment. So looking ahead, I would say that the National Prepare team, we are very excited to announce that a new version is being developed. This version will have some additional new domains such as health literacy, SOGI, looking at cultural, spiritual, and religious beliefs. And then with our current domains, we have worked with the field to make the language a little bit more patient-centric as well. And so we are really hoping to have this tool out to the public by the ending of the year, including with a revised toolkit, in addition to having the tool itself be translated into those 20 plus languages that I noted earlier. For additional resources on Prepare, we do have a standalone website, prepare.org. There's where you'll find all of our materials and resources. We do have a monthly newsletter that goes out as well. So that's a great way to stay up to date with what is going on with Prepare and what the NAC S2H team is doing in the field to address social drivers of health. And of course, you can have my contact information as well if you just have any general questions or you want to reach out. And I believe that wraps up my presentation.
Thank you so much, Nalani. I appreciate it. So we did end with a few minutes early, so I don't know if anybody has any questions. And Nalani, just to kind of paint a picture for you for New Mexico, I know we discussed this when we first spoke, but we're really in the earlier stages of trying to identify what works best when it comes to screening and what's the setting and what are the barriers and how do we overcome it? And we're also talking about closed loop referrals and making sure we're doing it all at the same time. And so I think this was a very timely presentation as some organizations are really trying to wrap their brains and update workflows that work best for them. And so I'm just kind of curious from the group, was there anybody that wants to kind of share? Is anybody already screening their patients or members or clients for social drivers? If so, what tools are you using? If not, is anybody else using Prepare or want to share any experiences? Kind of open it up. If nobody feels comfortable talking on camera, you're more than welcome to put it in the chat as well, or if you have any questions.
I think while we're waiting for folks to chime in with any questions or responses, I think everything that you mentioned, it can be overwhelming with learning how to collect social drivers of health, adding it to your workload, finding the right workflow, closing the loop on referrals. So I just want to reiterate, making sure that it's okay to start small. It's okay to do PDSAs. It's okay to take that step back to make sure that the staff members are fully comfortable with asking some of these questions and finding that right workflow. And it could be different with each team that is working on this, or if you have multiple centers, it could be different at each of those centers, but also really engaging the staff members who are involved. It's going to really help with the buy-in and also just making the buy-in and getting that information that's going to help with improving health outcomes.
Thank you, Nalani. I do have a quick question. So I know we talked about, making it, kind of a conversation with the patient or the client. What are your thoughts on doing prepare over the phone versus in person, like having the patient in front of you? I'm just kind of
Yeah.
curious what your thoughts are, and what's the best practice around that?
Yeah, we definitely have seen folks do complete prepare over the phone, especially during the COVID era, the height of COVID, and they have continued to do that with telehealth practices. And I would say most important, whether you're doing it in person or over the phone, is making sure you have enough time to have that conversation. Because once again, this is somebody's lived experience. It could be something that might be a story that they want to go into depth about and share with you. So you don't want to rush that conversation. And also, if possible, you want to have the same care team members follow up with that individual. What they've noticed in the field is that having an initial conversation with one person might just be the tip of the iceberg. But if you see that same person by the third, fourth time, you might feel more comfortable sharing a story or a need that you have that you weren't necessarily comfortable at the initial meeting.
Yeah, that makes sense. Thank you. Lindsay and team, I don't know if you have any other thoughts or, as it relates back to our heart and stroke initiatives, and screening for SDOH, any thoughts or anything that you'd like to share on your end? I know this is kind of something new for all of us really in the group, and I think we're really just trying to see what works best for each organization and to be able to support them in these endeavors for screening. So Lindsay, any thoughts, questions?
Yeah, absolutely. Personally, thank you so much for this presentation. I think we all really learned a lot and really enjoyed it. So thank you for your time. And you are correct, Bianca. We are just kind of in those beginning stages. We're here to help. We're here to really work together with both the Learning Collaborative as well as our partners to help with the implementation in any way. We do have a lot of QI experience and expertise on our team here, so we can certainly help with PDSA cycles. I think that that's a really good way to implement. It's always, we hear these things and we want to help so much that, that first inclination is to really roll it out on a large scale, and that's very, very difficult. And so we're here to help do those on small scales and stepwise ways to do that. So thank you so much for bringing that up, Nalani. And yeah, we're very excited to just really learn together and assist in any way we can as the Heart Disease and Stroke Prevention Program.
Thank you, Lindsay. So yeah, I think that's a great point, Lindsay. I think starting small, and Nalani, you kind of referenced that in a few slides, and I hadn't really thought about that, starting with new patients or starting with like a subpopulation. And so I think when we start thinking, well, we have to screen all these people that come through our doors or that we interact with, it really doesn't have to be that way, right? You have to start somewhere. So that was probably like the biggest key takeaway from me, having used Prepare before in the past at an organization. I think we just kind of felt like we had to screen everybody, but it's just not realistic, especially as you have hundreds of people coming through your doors daily. So I think breaking up your population to subgroups or just kind of really identifying and targeting and doing a pilot and kind of seeing where that goes. And once you start collecting data, that's the whole other part, right? Once you get this data, what do you do with it? And so if you're doing it in smaller chunks, it might be more actionable to break it up. And I think Nalani, we also live in New Mexico. We're a state who has very limited resources when it comes to housing and transportation. And so I also like how you said, we might not be able to them in that moment. And I think that's where I struggled, right? We'd have a member saying, or a patient saying, we need transportation and there was nowhere for me to refer them in that moment. But being able to just kind of have that conversation, I can do some research. Let me find out if there's any other resources and then compiling that information. So when we do have these meetings with DOH or with other partners or stakeholders, we could say, hey, we are struggling with transportation. Like this is a big issue. And I think in New Mexico, I think we have food down pretty good. And, everybody correct me if I'm wrong, but I feel like food, we got it down, right? We have a wonderful food banks and we have a great network of food partners, but it's that housing and transportation is where we're struggling. And so I think also arming those who are doing these prepared questionnaires you're not going to be able to help everybody that minute or the next day or even before they walk out the door. But being able to just say, we understand this is a need, we're working on getting some resources for you, and then we'll follow up or try to steer you in the right direction. So that was also a big takeaway for me. So Nolani, any other thoughts on, living in a state with, I know you work with a lot of different health centers in different states that have limited resources, how to navigate that conversation when we're asking these questions and we can't support them in that moment?
Yeah, so what we've heard from the field is that if you are really just transparent with the individual by saying, this is, a not prepare is not an application for a resource, but by, knowing this information, we can help improve your healthcare journey. We may not have resources at this time, something down that line, and allowing them to ask questions back. Folks are okay with like, okay, I understand I'm not, or maybe I guess it's more so they understand that they may not have all the resources right then and there, but the care team is going to be dedicated to helping this individual on their healthcare journey. And when you mentioned transportation, it reminded me of the story with this community health center. They were able to take the data that they gathered from the Prepare on the transportation question, look at the zip codes, and then go to their local bus company and their government and able to work with them with the data and the stories from the patients about not having transportation. And they actually created several new bus routes that were in those zip codes for the individuals who could not get to their appointments or could not get to the grocery store because there was no transportation. So by having that data, and once you get that data and you have those stories of those individuals, you can make some significant local changes.
No, I love that example. And also, I think you mentioned adding it to a care plan, right? Like knowing a patient doesn't have access to food, transportation, or housing, and how that could implement or affect their care. That's going to also inform the provider and their care team. Okay, well, this is why this patient has a high no-show rate. This is why this patient only comes on these days, or this is why this patient is struggling. So I think just like having that knowledge on the provider and or your organization and knowing the barriers that this person faces can also give you a little more empathy when they are no show or they're late or and when it makes, when it comes to doing their care. So I also thought that was important. So great. Thanks, everybody. I think we're near the hour. Thank you to those of you who are new to the collaborative who joined. We're excited for you to join us. During next month's collaborative, I'm going to be sending a save the date, but I believe it's going to be May 25th. Lindsay, I might be wrong, correct me if I'm wrong, but I believe that was the date we chose. It'll be another Thursday in May. It'll be a very similar setup. We'll send you a Zoom link and a calendar invite. During this webinar in particular, we want to hear from you. So we want to hear from our partners and who else is in the collaborative and what you're doing as it relates to not only health prevention and health promotion as it relates to cardiovascular disease, but how you're reaching your members and your patients and your organization. So we look forward to hearing from everybody in May and that next steps. I am going to be sending out a slide deck to everybody after this. Thank you, Lindsay. It's actually May 23rd. Our next one.
Yeah, May 25th is Saturday.
I will, yes, the 23rd is on a Thursday. So we will be sending out the save the day. I will also be sending out the slide deck with some links that Nolani talked about. And I also just want to plug the Health Equity Symposium one more time. Registration is now open. I put the registration link in the chat. There is a registration fee. However, scholarships are available. So if we do not want anybody to be discouraged from not attending. So please fill out the form to apply for a scholarship. We really encourage that. It'll be at the Airport Sheraton here in Albuquerque, and we look forward to seeing you all there. And Nolani, thank you so much for your time. It was wonderful to have you. Safe travels. I know you've had a crazy week. Thank you so much. And we will be in touch with everybody very soon. Thank you.
Bye. Thank you, everyone, for attending.
Thank
Thanks,
you.
everyone.